Okay, I want to add something for your introduction. I am now currently working as a medical physics consultant, nuclear medicine department, Burgin Medical City, Abu Dhabi. It's recently, that's the reason why I didn't update you. Okay, let's start together about talking about CT physics, technology, image quality, and computer tomography. Honestly, this topic is very big to be covered by one lecture, but I'll try to transfer my knowledge regarding CT physics, technology, image quality very fast. And I think I have another lecture next week. So if I miss something, I'll continue in another time. Okay, so let's start. I'll be more practical with you because this topic is quite important for everyone. As we know, that CT now is very important because it's one of highest imaging technique for radiation dose for patients, and also CT used now for hybrid imaging, SPECT CT, PET CT, and also is used for radiotherapy for CT simulator. So it's very important for any medical physicist to know how to make a balance between patient dose and image quality. A lot of medical physicists has a lot of medical physicists have a good background about CT physics, but really, to be honest with you, when I ask a lot of them how to implement CT protocol, how to make an optimization for patient dose and image quality, how to make the doctor or a physician be happy with the image, at the same time you transfer less dose to the patients, not really a lot of physicists know how to do this. Okay, from my experience, I'll be more practical with you, and I'll give you some practical knowledge, okay, how to implement CT protocol. Okay, outlines today, we'll talk about brief introduction about computer tomography. Second item will be factors affecting image quality, patient dose, and scan time. Third item will be how to implement CT protocol. Fourth one, image quality, indices, and artifacts. Brief introduction about computed tomography. Our journey started with computed tomography in 1972 with Godfrey Hounsfield from England, and he invented first scanner for CT computed tomography, but he need contribution from our physicist Alan Cormack from South Africa to help him to solve some mathematical equation for image reconstruction. After that, they awarded in 1979 Nobel Prize for their development of computer assisted tomography. Computed tomography is a Greek word, okay? As we see that tomography is divided into two parts, tomo and graphy. Tomo means picture, graphy means to write or describe, to be described. Okay. So as we see here is a great difference between 1972 in the scanner and 2021 in the scanner, and also in for CT brain you will get the image. As we see here, the image is not really nice, and you can differentiate between white matter and gray matter in the brain. But in 2021 you can get image. You can see very well differentiation between white matter and the gray matter in the brain and both ventricles. Okay, there is a great difference between the image captured in 1972 and the image nowadays in 2021. Also with different metrics, you will find this image in 1975 is matrix has 128 metrics, but here nowadays we are using commonly in CT, except for Petra's bone, 512 metric size, except in Petra's bone we are using 1024 metric size. Okay. So now, if we give some principle about CT, any imaging technique depends to get a difference between the tissue or to get a difference between the components or the objects inside our bodies. Like we see.
When I have a short class.
Sorry? Sorry, is there any problem?
Please continue.
Mr. Saad, continue or what's happening?
Sir, please continue, no problem.
Okay. So now, to get the difference between different tissues inside our bodies, any imaging technique depends on to get a difference between our objects or our organs inside our bodies. In MRI, you get a difference between tissue characteristic in magnetization properties like T1 constant, T2 constant, as you see here for this banana image, okay, and also for, okay. So, but the difference between X-ray image and CT image that here you can see, you can see here the organs inside the inside these patients, because all organs here are superimposed, so you can't see a lot of details. So the contrast resolution here is not very high. But in CT image, you can see a lot of organs with section thickness reach to 0.5 millimeters. So you can see liver, you can see spleen, you can see a lot of vessels, okay, and also you can see in different cross sections, axial view or coronal view or sagittal view. A lot of application for CT. You can use CT for three-dimensional image, for angiography, for brain perfusion, okay, and triphasic techniques. So CT nowadays has a lot of techniques and a lot of applications, especially for corona cases, a lot of CT cases or a lot of CT chest doing. So it's important to know how to make low dose protocol for CT COVID-19 patients. Okay. So now if I talk about the basic principle of CT, that we have X-ray tube which produce X-ray beam. This X-ray beam are incident on the patient. The patient, as I said before, that has different tissues like bone, air, soft tissue, fluid. Each tissue has attenuation characteristic or attenuation property differ from others. Each tissue will absorb a certain amount of radiation differ from other tissues. So the transmitted radiation coming out from the patients coming from bone differ from the transmitted radiation coming out from fat or soft tissue. So now the intensity of radiation coming out from bone will be detected here with a certain value, but the transmitted radiation coming out from soft tissue will be detected here with another value. So now you can get image with difference in attenuation coefficient, which will represent the image of CT finally. And all these transmitted intensity of radiation are detected by detectors, which convert these intensities of radiation to analog signals. After that, by analog to digital converter, converted to be these signals will be digitized to be stored in the computer. After that, converted to analog to be displayed on the monitor. As we see here, that this is our detector and this is X-ray beam, and this is the language of computer, which is a binary system 0-1. Okay, finally you will get the image like that. Here, as you see here, that the liver is gray and bone is bright and the air is black. Okay, according to the attenuation property of each material, you will find the gray value or the color of the component. Bone has a higher intensity, has a higher density, so higher attenuation coefficient. So the transmitted photon coming out from the bone will be less than the intensity of radiation coming out from air. So after the detector will translate this intensity of radiation to a certain value, which is represented by gray scale. Later on, we will talk about this issue in image reconstruction, I think in the second lecture. Okay. Modes of acquisition, you will find here in any CT room, you will find the gantry, and you will find inside the gantry X-ray tube. On the other side, in the opposite side, you will find the detector and the patients in between. Okay. So the main idea is that we are using the table to raise the patient to a certain level in the center of the field of view, and after that we'll move the patient inside the gantry, and the X-ray, the patient will be exposed to X-ray, and transmitted photons will be detected here by the detector to get the image finally. Modes of acquisition, you will find in any CT machines different modes of acquisition. You will find CT scout or CT radiograph. Sorry, you will find here SERView or pilot or topogram or scanogram or preview or pilot, different names for CT radiograph for this image. First of all, if you want to scan any patient, you have to do this image. You have to do this AB image and lateral image, as you see here, okay? This is the anterior posterior image and this is the lateral image. You have to do this scout image to plan the patient, okay, to both your start and both your end. If you want to scan patient for chest, So you have to cover, you have to make a scout for this area only. If you want to make abdomen pelvis, so you have to make a scout for this area only. This anterior posterior image will find that the X-ray tube is up, but here in lateral view, the X-ray tube will be in lateral position, as you see here, okay, and the detector on the opposite side, also here, okay. This is CT scout. It's very important to know that your patient inside the field of view from anterior posterior and also from lateral view. It's very important to know if the patient is centered very in the center of the field of view or under positioning or over positioning, okay. So to know the height of the table of the are you correctly position the patient, or is there any wrong? Second mode of acquisition you will find here. If you want to scan patient for abdomen pelvis, starting from here to the pubic bone, you have axial mode or sequential mode. Axial mode or sequential mode, as you see here, that the X-ray beam, you position the patient in this position. After that, you take you exposure the patient to take one slice. After that, move the table inside and take to take another slice, and so on, to cover the scanned area or the coverage area. But it takes more time, okay. And I think all CT machines nowadays are not using this technique for acquisition or for CT scanning. All of them using spiral CT scan. This one. Here, you will find that continuous motion of the table, at the same time, continuous motion of the X-ray tube and the detector around the patient, which make finally this spiral shape, as you see here. That's the reason why it's called spiral or helical CT. All CT machines now has this technique, which is appeared in 1990 years, okay, 1990. Spiral CT is very fast, okay, faster than a sequential technique, and I think all acquisition protocol depends on this technique. Okay. Factors affecting image quality, patient dose, and scan time. I want you to put on your mind very important thing, that we have 6 acquisition parameters affecting on the patient dose, image quality, and scan time. Okay, 6 acquisition parameter. Let's start with KV. That's the first one. Any CT machine, you will find option to change the KV. KV is a potential difference between 2 electrodes, cathode and anode. You will find different values according to the machine itself, from 70, 80, 100, 120, 140. So which KV you will select for the patient? If you want to scan patient for CT brain, which KV you will select? If you want to scan patient for CT abdomen pelvis, which KV you will select? So you have to know very well what is the effect of KV on the image quality, patient dose, and scan time. Okay, so now to know very well what is the KV effects on the image quality, let's talk about X-ray production. That X-ray production, we have cathode and anode, okay, and this cathode is connected with tube current, which is responsible for heating the filament. After that, by thermionic emission, you find a lot of electrons here produced. These electrons are moved or accelerated from cathode towards the anode. Acceleration process done by KV. According to the value of KV, if you increase the value of KV, so the acceleration or the electrons get more kinetic energy to move from cathode and towards anode. So the X-ray, which is produced here, will get higher energy or a higher penetration power. So increasing KV will affect on the acceleration of electrons, will give higher kinetic energy to the electrons moving from cathode to anode. So now the X-ray spectrum here, or the X-ray photons, which is coming out from the X-ray tube, will have higher energy. So when I ask you, this spectrum is for X-ray spectrum. This, if I ask you now, the X-ray, which is coming out from the X-ray tube, is monoenergetic or polyenergetic. Okay, sometimes I get an answer from some medical physicists that monoenergetic. No, it's polyenergetic. You have to know very well that the X-ray is coming out from the X-ray tube is polyenergetic. That means when you adjust the kilovolt to 120 kV, it doesn't mean that all X-ray photons coming out from X-ray tube has energy 120 kV, but that means that the most of energy or most of photons here has energy half to thirds the maximum energy, okay? So if, for example, if I get or adjust the X-ray tube for 120 kV, that means that the most of photon coming from the X-ray tube is around 60 kilovolt. Okay, so you will find here this continuous spectrum, which represent the Bremner-Strahlung X-ray, and this is spikes, which represent characteristic X-ray, which is coming out from the interaction between the electrons and the anode atoms. Here you will find if the incident electron coming out from the filament incident with the nucleus itself, so this will produce the maximum energy of X-ray photon, which is here. But the probability of this interaction is very low. So you will not find here higher intensity of this or higher number of photons get this value. That's the reason why you will find here maximum photon of energy. Not many photons have this value. Okay, so if the incident electron incident on far away from the nucleus, okay, as far a distance from the nucleus, so you will get another photon energy with the moderate energy. So now, but the probability also to get these photons with moderate energy is not very high, but it is not less like maximum energy. Okay, but the most of photons, okay, you will find the most of photons in the region of half to third of maximum energy. Okay, so now when I tell you that I adjust the X-ray tube at 80 kV, that means that most of photons coming out from the X-ray tube has energy is around 40 kilo electron volt, but 120 that most of photons have energy 60 kilovolt. Okay, this is another type of interaction between the incident electron and the atoms of target anode, which knock out the electron, K-shell electron, to knock it out from the atom, and another electron coming out from higher orbitals or higher ground state. Okay, and the difference is represented by characteristic X-ray. Okay. So, but we are depending on the imaging technique on Bremner-Strahlung X-ray for CT. So increasing kV, what will happen to the X-ray spectrum here? Here you will find this is a spectrum of low kV and this is a spectrum of high kV. Increasing kilovolt, increasing the maximum energy, as I said before, and also increase the intensity of radiation because exposure is directly proportional to the kV square. So when you increase the kV from 80 to 120 kV, you increase the intensity of X-ray, you increase the maximum energy of X-ray photon. Also, you increase the mean energy. Here is the mean energy will be higher than the mean energy of low kV, but no change in the minimum energy because the minimum energy of X-ray depends on the filtration. And no change in the scan time. So now, when you increase kV, you increase the maximum energy kV, and also you will increase the patient dose. Okay, you increase the patient dose, okay, because you increase the exposure and you increase the intensity of X-ray. So, but no increase in the scan time. So what will be happen to the image quality when increasing kilovolt? As you see here, this table represents different kV values from 80, 100, 120 to 120, 140, and what happened to CT dose index. We will talk about this parameter in the next lecture, which is representing the dose of patients. Now you will get that using 80 kV, the dose is 14 milligray, but 126, 120, 40, 140, so a higher. So minimally change in kV cause higher increase in patient dose. Okay, this is for CT for phantom forehead, okay, which is 16 centimeter, but this is for body. But you, as you see here, you can get a difference between at the same KV. You will find here for body, okay, for body phantom, which is 32 centimeters, the dose is less than the dose for 16 centimeter. Okay. We will talk about this if you have two patients, one of them is thin patient and another one is obese patient, and you adjust the same KV, same parameter, same milliampere, same rotation time, same pitch factor, everything is the same for the two patients, and one of them is thin and another one is obese patient. You think that the two patients will get the same absorbed dose, or there is a difference? Okay, we will talk later about this issue. Okay, so now what will happen about the image quality? Here using low energy KV, here using higher energy KV. So the transmitted photon coming out from the patient in case of higher energy KV will be higher than the number of photons coming out from the patient in case of low energy KV. That means higher number of photons will reach our detector, so less noise. So noise now will be less using high KV than using low KV. Okay, as you see here, this is a case of, you have to know very well that now we are using low KV for cases of angiography, for cases of contrast, and 80 KV or 100 KV is more effective to get image with high contrast, more the higher contrast than higher KV. Okay, this for many reasons. High KV, okay, if you have here different components, bone or contrast, fat, air. Okay, so using a higher KV, you will find that transmitted X-ray photons, which is coming out from air, fat, bone, no great difference between bone and fat or contrast and fat, no great difference, no much difference between them. But using low KV, you will find the great difference in the intensity of transmitted photons between contrast and fat. That's the reason why you will see here is the aorta. Okay, you more bright than this is on using 80 KV, but this image appear on using 120 KV. Here is the aorta is more bright than here. Okay, because as I told you before from this diagram, that the number of photons transmitted from higher density material like contrast or bone will be less than the transmitted photons from aorta or bone in case of high KV. So there is a great difference between the intensity of radiation transmitted in low KV than the difference in intensity of transmitted radiation in case of high KV. So this is the first reason. This is the first reason. But also using low KV, here in 80 KV and 120 KV, you can get the difference very easy. Okay, and here also in this is CT abdomen, this is aorta and the corticomedullary region. Okay, and also here a lot of papers talking about this issue using low KV in case of contrast cases. It's more effective. Okay, also in coronary angiography, using 100 KV is more effective than 120 KV. Okay, as you see here, the difference between coronary arteries and the background, and here in 120 KV. So the coronary arteries here has higher contrast in low KV than higher KV. So also you will find in some triphasic cases or liver cases, focal lesion. Focal lesion has less difference in attenuation between the focal lesion and the background. So using low KV, okay, increase the contrast or increase the visibility of this focal lesion, okay, in liver. Okay, you can see the difference here that this lesion, okay, it has less contrast than on using 100 KV. So 100 KV enhances the contrast resolution. Contrast resolution means that you get the difference between two objects has a little difference or less difference in attenuation characteristics. Okay. Also here using 80 KV and 120 KV. Okay, you see here the contrast media inside the bowl more bright, and the Hounsfield unit also is very high, which is represented the density of the material. But on using 120 kV, the Hounsfield unit is very less, is less than the contrast media or the Hounsfield unit on using low kV. So second reason on using low kV. Why? Low kV is more effective in iodine cases or contrast media cases. As I told you before, that the transmitted X-ray beam or the difference between the transmitted beam from the high density material, and also using low kV, that means that the mean energy on using 80 kV, the mean energy will be around 44 kilo electron volt. The mean energy, you remember the spectrum. On using 100 kV, the mean energy will be 52 kilo electron volt. Here, 120 or increasing kV, increasing the mean energy. So now, as we know that we have two interactions happen inside the patient. On incident of X-ray beam on the patient, you will get photoelectric effect interaction and the combaton scattering interaction. Which one is dominant in low energy? The photoelectric effect. So photoelectric effect means that the photon is totally absorbed inside the patient. But combaton scattering means that we release the scattered photon. This scattered photon, okay, reduce the contrast of the image, but photoelectric effect enhance contrast of the image. So using low kV enhances the probability of photoelectric interaction, which is affecting on the image contrast to get it higher. But on using higher kV, so the combaton interaction will be more dominant, okay? So that's reduce the image contrast. So now you will find that the K edge here, this is for iodine contrast, the K edge, the electron which is in the K shell, has a binding energy 33 kilo electron volt. So there is a matching between, the incident photon in case of low energy KV, which is around 44 kilo electron volt in case of using 80 kV. This matching between, or this matching or slightly higher than the binding energy of the electron makes the probability of the photoelectric interaction inside the iodine or contrast media be higher. Okay, but in case of using higher kV, okay, so there is much difference between the mean energy and the binding energy of K of the electron, which is in K iodine. So now the probability of photoelectric interaction become less. So we have three reasons, okay, to know very well that using low kV is very important in case of using iodine cases or contrast media cases. Okay, here there is a relation between mass attenuation coefficient and energy. As you see here, that at low energy, that you will find here, the mass attenuation coefficient for bone is higher than the tissue because the photoelectric interaction is higher for bone and higher for iodine. Okay, and also for 80 kV, you will find here the mass attenuation coefficient at low energy is higher than the mass attenuation coefficient for 140 kV. Okay, so lower kV imaging is very important in case of using limited IV contrast. Sometimes we are not using too much contrast for patients, like CT chest, sometimes using 50 milliliter of contrast media. So low kV has a benefit in these cases. Some patient has a renal problem, so you can reduce the contrast media, or sometimes you have a contrast media with a less concentration, like you will find in the market different types of contrast media. You'll find with different concentration. Sometimes you will find 370 milligram per deciliter. This is for Omnibac, or find 350 or 300. So less concentration. Using lower kV has a benefit, has a great benefit on using low concentration and low volume of contrast media. Also to get subtle attenuation differences. Also for small patients and for young patients. So for child, if I ask you, you have a case for baby or you have a case for a child coming to your radiology center to do CT for abdomen, which KV you will select? 120 or 100 or 80? Sure, I'll use 80 kilovolt. So you have to keep it in your mind. Using low KV with child, with baby, with moderate sized patient, with young patient, okay, small and medium sized patient, but only use higher KV 120 or 140 in case of obese patient, especially for pelvis region. Sometimes coming to your radiology center patient to do CT abdomen build, and this patient is very fat, so you have to increase the volt to reach 120 or 140 kilovolt to get this image. But as you see here, on using 80 kV, this is artifacts, photon starvation artifact, or this white and dark strikes, which is so bad, and it is not diagnostic image. So you have to use higher kV only in obese patient, only in obese patient. So now, lower kV, better image contrast resolution, generally standard. Normally, a lot of radiology center using 120 kV, but try to use 100 kV or 80 to 100 kV, okay? And for when kV is increased from 120 to 140, that's causing increase in the dose 39%, okay? Any minimal change in kV cause higher increase in the patient dose. kV, on increase in kV, noise will become less, contrast become less, dose become higher. So lower kV has higher contrast to noise ratio. Someone can ask me now that lower kV will affect on the image noise. Yes, you are right. Lower kV will make the image more noisier, okay? But the contrast become more higher than higher kV. So the contrast to noise ratio in case of low kV is higher than, in case of low kV, is higher than the contrast to noise ratio in case of higher kV, okay? So that's the reason why we are using low kV in case of contrast media cases, in case of a small size patient, okay, and medium size patient. Okay, so that was the first parameter, okay? You can use it. You can adjust it in your CT protocol. Second parameter is milliampere. Okay, as you see here, what happened to the spectrum when you increase milliampere from low current to high current? Here, is there any difference in kV in the energy of X-ray photon produced from the X-ray tube? No difference. Is there any difference in minimum energy? No difference. But what happened? What happened is the difference in intensity of X-ray beam coming out from the X-ray beam. Using higher current or higher milliampere, increase the intensity of the X-ray, but no increase in energy of X-ray, no increase in scan time. If I talk about milliampere, not milliampere second, okay? So the only difference is the intensity, okay? The mean energy is the same, but the intensity of X-ray. So the patient dose will be higher. There is a linear relationship between the milliampere and patient dose. Increasing milliampere, so the noise here, what will happen to the noise of the image? Here, less milliampere, here higher milliampere. So higher number of photons will coming out from the X-ray tube, but here less number of photons will coming out from the X-ray tube. Also, the higher number of photons will be transmitted out from the patient, so less noise. So high number of photons are detected. Here, higher noise because less number of photons are detected. But here, noise less, okay, but higher dose to the patient. So you have to optimize. What is the milliampere? I have to use it with certain patient, with child, with baby, with obese patient. If you want to calculate the noise, it's easy to get it through daily QC. We are using water phantom and draw ROI, region of interest, and measure standard deviation. Okay, here you will get a difference in the standard deviation value between the image in the left side and the image in the right side. The image in the left side, this image is scanned by 100 milliampere and 0.8 second time or rotation time, while the image on the right side is 50 milliampere. As you see here, the noise is appeared, okay, in this image because we are using less milliampere. Also, for patients, okay, this image, what do you think? This image is higher noise or less noise? Sure, it's less noise, and here noise increase. Okay, so if you take a region of interest on the liver region, for example, you will get here Hounsfield unit or value, which is called the standard deviation, which represents the noise of the image. Okay, here this standard deviation represents the variation in the CT number or the variation in Hounsfield units. If you get large variations, that means that the region of interest contain different pixels with different pixel values. But if you get small variation, that means the region of interest contain pixel with less variation in Hounsfield unit values. That means less noise. So now this standard deviation value is 9 Hounsfield unit, which is higher in the second image, with higher in third image. That means increasing in the noise because this patient is very fat. As you see here is the fat thickness. So this patient has to you have to increase the milliampere to reduce the noise of this patient. As you if you want to measure also the noise, this patient 120 kV, but the only difference here in 30 milliampere second, here 15 milliampere second. If you take a ROI here on the liver region, you will find here standard deviation is 60 and here standard deviation is 96. So higher standard deviation mean higher variation in the CT number, mean higher noise. Easy, it's very easy to get the image noise in your CT scanner or to check the CT noise every day, to check the CT number accuracy using a water phantom and to check to take a ROI. And also if you change in CT acquisition parameter and if you want to check the noise of liver region, that's easy to take region of interest and to see or to monitor standard deviation value. So you have to change milliampere with patient thickness to get the same standard deviation value or to get the same noise level, the same image noise. So sometimes I'm asking my friends that on scanning child or baby for CT abdomen pelvis, sometimes using the same protocol for adult, it's very, now we are exposing this baby to very high dose, okay? And you will get the image the image blurred, okay, without any details, okay, because noise sometimes we're giving you some details and increase the spatial resolution of the image. So you have to be optimized. What is the milliampere I have to use for this patient? If I have obese patient, so I have to increase the milliampere. If I have a small patient and a moderate sized patient or baby or child, I have to reduce the milliampere. So now,
sorry to interrupt you. I just want to remind you that there are only around 20 minutes left for the lecture. You can please continue.
Okay, I have no enough time, yes? Okay, I'll hurry up. Okay. So now lowering milliampere by 50%, reduce the dose by 50%, but increase the noise by 41%. Okay, so you have to reduce the milliampere with CT chest, okay, because there is high inherent contrast between lung and parenchyma and solid lesions. Also, but in case of liver, there is low inherent contrast between parenchyma and lesion, so you have to use higher dose. Okay, so increasing milliampere, reduce the noise, increase blurring, and increase the dose to patient. Okay, third parameter, which is very important, milliampere modulation. You will find different names of milliampere modulation with different vendors like SmartScan GE, DOM for Philips, CareDose for Siemens. This is for angular modulation, and for longitudinal modulation and angular modulation, you'll find Smart Milliampere in GE, DOM for Philips. What is the concept of this modulation techniques that we have as a patient. If we take a scanogram or scout for patient for chest and abdomen, you will find different attenuation characteristic for different body regions. Like lung has less attenuation than liver, so you have to change milliampere with the patient size or the organ, or to get the same noise level. As you see here, we give this chest region. Okay, this is shoulder region, so we give here higher milliampere and reduce the milliampere in this chest region, and after that increase milliampere a little bit to get the same noise level. This is for longitudinal modulation. As you see here, sometimes it's called automatic current selection, and it is has a great benefit in neck, CT for neck, and CT for chest, abdomen, pelvis. For any region has a different variation in the body contouring, okay, or body density. Here you will find here, if you scan patient from abdomen to pelvis region, here you'll find this cut in lung has get 68 milliampere second, but for abdomen increase little bit to 105, for pelvis 94 milliampere second at the start of pelvis, but here at the middle of pelvis 122. So different values of milliampere to get the same noise level or the same image quality along the Z-axis of patient. Okay, as you see here, this is the noise level, and this is representing the modulation of the parameter here on using constant tube current, and you will find the noise is different. Okay, in the chest region, noise here is less, but becomes higher here in abdomen region, and becomes more higher in pelvis region. Here, fixed or constant noise level because we are using those modulation techniques. Those modulation techniques is available in all CT vendors nowadays, so we can use it for Z longitudinal modulation or transversal modulation. Also, transversal modulation means that that the X-ray tube rotate around the patient, okay, and here the X-ray tube facing here low attenuating material, so give less milliampere, but here in this side facing higher attenuating material in pelvis region, so give higher milliampere. This is called angular modulation. As you see here, different milliampere. In this region, we are giving patient 54 milliampere, but this region we give patient 146, and here 200 milliampere. Okay, so the different values of milliampere, this is called angular modulation, is more effective to reduce the patient dose, reach to 50% reduction in the patient dose, okay, with the same image quality like fixed milliampere. The scanner itself takes the information from the localizer or from the scout, so it's very important to make centering of the patient in the center of the field of view, because if you make the centering of the patient to be lower centering, that's cause milliampere underestimation. But if you make the patient higher centering, that's cause milliampere overestimation. So it's very important to make sure that the patient in the center of the field of view using laser alignment. Also, it's very important to take AB and lateral for scout, because the scanner itself gets the information from AB and lateral to estimate the milliampere for each region in the patient. Okay. The fourth parameter is rotation time, which is the time it takes for the tube detector unit to rotate once around the patient. Here, the X-ray tube rotate around the patient. If the X-ray tube takes more time to rotate around the patient for one acquisition, that means we are exposure the patient to higher radiation. That means we are reducing the dose. So you have to select very well what is the optimum rotation time for patient. Okay, as you see here, this image has photon starvation artifacts. Okay, in comparison to this image here, the rotation time is 0.4 seconds, but here the rotation time is 1 second. So higher exposure to the patient. Okay, higher exposure, but less noise, but higher patient dose. Also, increasing rotation time increase the probability of motion artifact, but sometimes you scan patient with disturbed conscious level or child, so you need to scan to be very fast. So you have to reduce the scan time, reducing the scan time by rotation time. So increasing rotation time, increasing scan time, so increasing the probability of motion artifact, increasing the patient dose. Okay, and also increase the blurring effect. As you see here, the rotation time speed is 0.5 rotation per second. Here, rotation time is 1 rotation per second. Here, as you see here, the motion artifact is appear in comparison with this image. Okay, so rotation time increase, noise become less, blurring become higher, those become higher, scan time become higher. So fifth parameter is detector configuration. Detector configuration. Okay. Nowadays we are hearing that we have 16 slice of detector or 32 slice of detector or 64 or 320 row of detectors. Okay, so what's the difference between 64 and 128 or 32? That means if you have single row of detectors, so the coverage area is the coverage area is less than the coverage area using a multi-row of detectors. For example, if you have here 16 row of detector and each detector which is 1 millimeter, that means per acquisition you can cover around 16 millimeter per acquisition. But if you have here one detector with detector width is 1 millimeter, so per acquisition you can only scan 1 millimeter. So detector configuration, you have to select the proper detector configuration in the CT protocol to cover the area. Okay, for example, if you have 16 row of detector and you have to select the 16 row of detector, so with which thickness, 1 millimeter
Hello, sir. Are you there?
single row of detector and we have multi-detector CT 64 slice. If we assume that we want to take slice thickness, are you hearing me?
Yes, sir. Please continue. Maybe your internet was problem
Okay.
for a few seconds. Please continue.
Okay. Okay. So now, if I have now single row of detectors, so the slice thickness, I want to get slice thickness 2 millimeters, so I'll make the beam width here. This is the beam width. I'll make it 2 millimeter. This is for single row of detector. So the slice thickness for single row of detector is determined by the beam width. So now, to cover 2 millimeters per acquisition. So the scan coverage to get 20 centimeter in the patient, so I need to scan coverage 200 millimeter. So number of acquisitions needed, okay, to scan 20 centimeter in the abdomen, 100. So I need 100 seconds to scan patient with single row of detector, 100 seconds, okay? It's long scan time. But here for using a multi-detector CT, we have 64 row of detectors. So on using detector configuration 64, and each detector which is 0.625, this is the detector width of the slice thickness. So scan coverage now per acquisition is 40 millimeter, which is 4 centimeters. So I need 5 number of acquisitions only to get 20 centimeters scan. So now, on assuming rotation time is 1 second, so I need only 5 seconds. So it's a big difference between using single row of detectors and multi-detector CT. Okay.
स्क्रिन अरु आएन हैन
Sorry. Okay. So using a multi-detector CT is more beneficial to cover area of the patient higher than single row of detector. But the question is, which detector configuration I have to select? Sometimes you are using detector configuration 64 1.25 millimeter times 1.25 millimeter, or using 64 0.625 millimeter. It depends on the scan region. It depends on the scan region. Here, if I want to scan a region like knee, like wrist, hand, elbow, ankle, foot, vitreous bone, so I need high resolution or less resolution. I need high resolution, so I need to get sections or image with with slice thickness very low, which is reached to 0.6 to 5 millimeter, because there is higher probability to get a lesion or to get a fracture or to get a problem, a pathology in the patient in this thickness. But on scanning CT abdomen pelvis, CT triphasic, CT angiography for aorta, okay, is there any need to use 64 or 16 times 0.6 or 0.5 millimeters? No need. If you scan the patient using 16 row of detectors with thickness 0.5 millimeter, in case of CT abdomen or CT abdomen triphasic, you take longer time, you expose the patient to higher dose, okay, and the image, you will not get higher difference in the image quality, okay? You will not get higher image because there is no probability to detect any lesion for CT abdomen or CT triphasic reach to 0.5 millimeters. So 1.25 millimeter is enough for you, in case of chest, abdomen, pelvis, neck, angiography, pulmonary angiography, lower limb angiography, carotid. You can use 16 or 64, 1.25 millimeter or 1 millimeter. But using 16 0.5 or 16 0.625, okay, you are exposing the patient to higher dose of radiation, okay, and increase scan time, make tube overloading on the X-ray tube, and need to keep the to leave the X-ray tube sometimes to be cooled down. So you have to select which detector configuration you need, okay, for the scan. Okay, so for TV, for milliampere modulation, also for milliampere modulation. If I want to scan for CT brain, I use milliampere modulation technique, no benefit because constant contour of patients. So no need to make milliampere modulation for it. But for chest, abdomen, pelvis, for neck, it's beneficial. So you have to select the parameter which is beneficial for the scan organ you need it, okay? So for rotation time also, nowadays you will get rotation time 0.5 second, 0.6, 0.75, 1 second, okay? So when I use 0.5 or 0.7 or 1 second, okay? So the standard for 16 row of detectors, 0.7 second, using 0.7 seconds. Sometimes we are using 0.5 second if the patient is a child or the patient is, there is a probability the patient to move. So you have to use less rotation time to speed up the process. Okay, when I'm using 1 second, only you can use 1 second, in case of lumbar spine, because sometimes patient coming to your radiology center is as a obese patient, so you need to increase the rotation time, okay, to reduce the noise of the image, okay, in case of obese patient, okay, and for lumbar spine. And also you can use 1 second or as a rotation time for CT brain, because this region need higher penetration and higher dose to get best image quality.
Dr. Kamal, sorry to interrupt you. We only few minutes left.
Okay. The 6 parameter, I can get 1 minute.
Yes, sir. Please continue.
Okay.
Finish.
For your CT scanner, you will find pitch factor or helical pitch. Helical pitch indicates how much the table moves during the rotation time. Okay. For pitch factor, it's equation using the table displacement during one-fold 360-degree rotation divided by the beam collimation or the detector configuration. For example, to understand this very well, if table moves 16 millimeter per rotation, per rotation, and detector configuration is 16 times 1 millimeter. Now the pitch factor is 16 millimeter per rotation divided by 16 times 1 millimeter, so 16 by 16, which is 1. So you will find in your machines the pitch factor is 1 for this value. That means you will get this image. There is no, for pitch factor is 1, so there is no overlapping of the beams, overlapping, or that you are covering the area very well and with optimum resolution. But if the pitch factor is higher than 1, so you are lost here, not some data, but you are losing here some special resolution of the image. Okay, so if table move 8 millimeter per rotation, so the result will be pitch factor will be 0.5. That means the table move distance less than the detector coverage. So there is overlapping, okay, overlapping in the beam itself. So if table move 32 millimeters, that means we are moving 32 millimeter per rotation and the detector coverage is 16. That means the pitch factor will be higher than 1, which is reached to 2. So now this is in case of pitch greater than 1, and this is in case the pitch is lower than 1. Okay, so when I use pitch greater than 1, if I use pitch greater than 1, so the patient dose become less, but the spatial resolution also become less. So you have to select the proper pitch factor for CT scan, which you need. Okay, for CT chest, abdomen, pelvis, neck, you can use or abdomen triphasic or abdomen angiography. So you need scan time become less and reduce the exposure to patient. And also spatial resolution is not a significant factor in this case. So you can use pitch greater than 1 in case of chest, abdomen, pelvis, triphasic angiography. But on using pitch less than 1, okay, in case of CT scans needs a high resolution, like CT Petraspon, like CT for wrist, for ankle, for foot, for Petraspon. So you have to select pitch less than 1. I recommend everyone to go to CT machine, okay, in his radiology center and review all CT protocols and to adjust it, okay, to be optimum, to reduce the patient dose, also to get the optimum image quality. Okay. I really want to continue, but here's if we use pitch factor 1.5, that's increase the speed of table speed 50% greater and also reduce the patient dose 33%. Okay. Thank you.
Thank you very much, Dr. Kamal. I hope everyone enjoyed that lecture. There are a few questions. Can we start the questions?
Yeah, sure, please.
Okay, so we have we have a question that why patient dose increase when we increase the tube rotation time?
Sorry.
Why patient dose increased when we increase tube rotation time?
Again, can you raise your voice, please? I can't hear you.
Okay, let me.
Or I am opening now chat window. I can't see the question.
Can you hear me now?
Yes, I'm hearing you.
Okay, so there's a question from Mohammad Yasin. Why patient dose increased when we increase tube rotation time?
When you increase rotation time, okay. Okay, here you have many options. If you increase the rotation time from 0.5 or 0.6 or 0.7, that means you take longer time to move around the patient to take one acquisition. Okay, to cover the scan or to cover the acquisition, you take longer time. If you take longer time, that means you are exposing the patient to higher dose. Okay, that means you are exposing the patient to higher dose because you take longer time for exposure. So normally or by logic, you are increase the exposure to patient. Okay, for example, if we use 300 milliampere, okay, and you are using rotation time 1 second. So that means you are giving patient 300 milliampere second, which is called effective milliampere. Okay, but on using 300 milliampere and using rotation time 0.5, that means we are giving 150 milliampere second, which is the effective milliampere. So now the dose become less, so the exposure become less. You get it? And also the noise become higher.
I hope that answers the question. We have another question from Alex Fernandez. Is there a correlation between detector width and slice width?
Sorry.
Is there a correlation between detector width and slice width?
Yes, section collimation and actual slice width. Okay, so now section collimation and slice width. Okay, so you have in your machine what's called beam collimation or detector configuration. Okay, so when you select 16, for example, 16 0.6 millimeter or 0.625 millimeter, okay, you can't, that means you are using the detector width, which is 0.625 millimeters, okay? But the beam width itself is around the total area or the total coverage area. For example, here, okay, this is a single row of detector, okay? Here, in the single row of detector using the beam width itself, which determines the slice thickness. But nowadays, we are using the multi-detector or multiple row of detector. Here, you will find the beam width is not a determinant for the slice thickness. Slice thickness is determined by the detector width itself. The detector width itself, but the beam width you are talking about how many detectors I have or I use. If I use 16 row of detectors in and the detector width is 1 millimeter, that means that the beam width itself is 16 millimeter, but the thickness of detector is one millimeter. Okay, so so that means that I can reconstruct the image to get 2 millimeters, 3 millimeters, 4 millimeter, 5 millimeter, and so on. But I can't reduce the reconstructed image less than the detector width I used itself. Okay, so if you use the detector configuration 16 times 1 millimeter, so you can't go to raw data to reconstruct the image less than 1 millimeter. Okay, so you have to use it. You have to make sure that this is the detector configuration. You can't go back and reconstruct less than the selected one. It's clear?
Yeah, I hope that answers the question. We have another question from Muhammad Amir Ali. What is the effect of matrix size and reconstruction kernel on image quality?
Again, I want to get your.
What is the effect of matrix size and reconstruction kernel on image quality?
What is the effect of the matrix size? Yes?
Yes, matrix size.
Okay, normally in CT we are using 512, okay, matrix size. Matrix size, it depends on, if you increase the matrix size, that means increasing the number of pixels, okay, with constant field of view. For example, if you have a field of view of any image in your mobile phone, for example, okay, if nowadays we are using 25 megapixel or increasing number of pixels, but previously we are using 1 megapixel or 0.5 megapixel. That's increasing in number of pixels, means increasing matrix size. Increasing matrix size, okay, give higher resolution of the image. That's the reason why we are using higher matrix size in case of Petrasbone. We are using 1024 as a matrix size, okay, in Petrasbone. So increasing matrix size reduce the pixel size, which is equal to field of view divided by the matrix size, pixel size. So pixel size become less. That means you have a higher resolution in the image. But to be honest with you, we are not using higher than 512 as a matrix size in CT image, okay, except in case of Petrasbone, because Petrasbone need more higher resolution of the image, okay. To detect any lesion can reach to 0.5 millimeter as a slice thickness, and you get a difference between the air and the Petrasbone itself.
I think that answers the question. We have another question from Muhammad Yasin. What will the effect on patient?
Yes.
Sorry?
Yes, can I ask?
Yeah, sure.
what is the relation between kV and milliampere when we use AC modulation, automatic exposure modulation, when at contrast, when we change in kV, the milliampere changing.
Sorry again. You want to tell me something? What is the relation between kV and
kV and
milliampere?
milliampere, yes.
Sometimes you will get something is called tube rating, or maximum tube load. Sometimes in some machines like Philips, when you change a kV or you increase higher kV, okay, it is not allowed to use higher milliampere at the same time, because the machine itself, okay, it is not allowed to give higher kV and higher milliampere with this scan time. So I advise you, okay, or advise any medical physicist on acceptance test, he has to get tube rating chart and cooling rating chart. Tube rating chart is very important to know what is the maximum kV and maximum milliampere and in a maximum exposure time. So sometimes you adjust kV at certain value and adjust milliampere higher also, but the machine will not accept. And sometimes during the scan, cut the scan, okay? It happened with me before, okay? And if the machine allowed for you to continue the process, so you have to be careful that about the machine capabilities, or the options of the machine, tube rating chart and cooling chart. You have to see or you have to check the tube rating chart to know the maximum kV and maximum milliampere at maximum exposure time. You understood?
I think we got the answer. We have the last question. What is
I answer you or not?
Yeah, I think she got the answer.
Okay.
What is there's another question? What is appropriate KVP for CT angiography? Is there any possibility of
Sorry again. Sorry.
What is the appropriate KVP for CT angiography?
What is
appropriate KVP? Kilovoltage.
Appropriate KV for angiography?
Yeah, CT angiography.
Okay, for moderate size patient, and same patient from 80 to 100 maximum. From 80 to 100 maximum. A lot of papers, you can see it easily, talking about low KV efficiency in case of contrast media, not only angiography. Okay, for moderate size patient, using only 120 kV in case of patient is obese. It's clear?
Yes, clear. Okay, thank you again, sir, for answering those questions and for the great lecture. It was a pleasure to you have with us. And I end with thanking for today's session, especially Chairman STMPCR, Dr. Ghulam Abdu Zakaria, and entire team of STMPCR whose efforts have made this session a success. Thank you all participants.
Let me share with all my colleagues my contacts, okay? To if they need any help.
Thank you, Dr. Islam Kamal, for your excellent speech, and you have very clearly defined the different parameters in a CT. It is a little bit complex. I know the CT machine is a complex for the medical physicists, but they should know the relation, multi-slice, pitch, helical CT, and everything. When this clear, then they can optimize the machine. So it is actually important, this parameter first, and then they can optimize. Yeah, there is a many process you have explained very well. I think it is a very introductory lectures, and you go also inside, and the people just participate. They can deep knowledge when they read more and more and more. And you can find such optimization problem also in internet. Yeah, go to the YouTube and you can hear the lectures, many lectures there. It's possible to do good. But thank you once again, you are with us, and I hope you will also, the next lecture is also very, very interesting, and everybody will present there. Yeah, thank you.
Thank you
so
all the
much, sir.
participants.
Thank you.
Thank you very much, Dr. Islam Kamal, for your wonderful presentation. And I
Thank
would
you.
like to welcome all the participants for tomorrow lecture, which is QC in Interventional Radiology by Dr. Stephen Garvey. Thank you.
Thank you so much.
Thank you.
Thank you all. Thank you, Dr. Islam Kamal and the whole team, Dr. Saad and
Thank you.
Ghulam Abu Zakaria. Thank you very much.
Thank you, Muhammad.
Thank you, Saad, for your excellent
Thank you,
moderation.
sir.
And I see also here Dr. Professor Franco Milano is also present there and encourage us for our lectures. Yes, thank
Yes.
you.
Thank you so much, Dr. Franco Milano, sir, for your support in our program. Thank you. Goodbye.
Goodbye.